ectopic pregnancy is a pregnancy that develops outside of the uterus.
Because this type of pregnancy is extremely dangerous to the woman, the doctor must terminate the pregnancy in order to give the woman the best chance at survival. Due to the necessary termination, the baby is unable to survive the pregnancy.
The egg begins by growing outside of the uterine cavity. By doing this, it can cause rupturing and hemorrhage. The most common site for an ectopic pregnancy to occur is in the fallopian tubes.
Only 2% of pregnancies tend to be ectopic, but 9% of pregnancy-related deaths during the first trimester are due to an ectopic pregnancy.
In order to better understand this type of pregnancy, we interviewed a woman who went through the experience of what the doctors thought to be an ectopic pregnancy. EOP counselor Nancy Brown speaks out to help others better understand. We asked Nancy 5 questions in the hopes that other women, like Nancy, can better prepare themselves and or prevent an ectopic pregnancy from happening. Here we see exactly how the interview went. Nancy Brown.
Yes.
I'm going to interview for the women's health class on ectopic pregnancies. Question 1. Some of the risk factors for an ectopic pregnancy include C-sections, tubal surgery, infections, being over the age of 40, having multiple sex partners at a young age, smoking, and even douching, using contraceptives and having them fail, previous miscarriages, abortions, and IUDs. The most common risk factor is pelvic inflammatory disease. Knowing some of the risk factors, can you recall having any of these factors that may have led to an ectopic pregnancy?
Yes. While I did not have an ectopic pregnancy, they thought I did, and it was actually an ovarian cyst. It ruptured and blew out and also took my tube. So they thought at the time it was an ectopic pregnancy. I previously had an IUD and had to have it removed. It was the old copper 7 way back in 1976. And I did have a pelvic inflammatory infection and ended up having my menses for 26 days. It stopped before and then it started again. The other reason that I had multiple sex partners and also smoking. Never had an abortion. It was lucky there. And what was the other ones I said?
C-section,
No.
tubal surgery, infections, being over the age of 40,
Nope.
douching,
Nope.
using contraceptives and having them fail.
No, other than the copper 7, and it failed not because of pregnancy, but because of the just incredible heavy period.
Any previous miscarriages?
Yes, I had a miscarriage in 1988. I had a pregnancy after I had the tubal. After I had the right tube and ovary burst. That was in July of 85. I got pregnant in January of 86. And then I had a second pregnancy I was pregnant in the spring of 88 and miscarried August 3rd of 1988.
Having multiple sexual partners at a younger age or rough sex can lead to an ectopic pregnancy due to the stretching and potential scarring of the uterine lining.
How did the doctors go about treating the pregnancy?
The ectopic, or when they thought it was an ectopic pregnancy, the first thing they did, because it was a ruptured cyst and ovary, and I didn't have insurance at the time, so I held out. It was really painful, and I didn't have insurance, so I held out for about 8 hours before I went to the emergency room, and I wasn't married, but it's my husband now. At the time, he just said, you've got to go, this is crazy. So the first thing he did was to give me a pregnancy
Were you able to conceive after the ectopic pregnancy?
Yes. As a matter of fact, what was really interesting is I hadn't had birth control because instead of a tipped uterus, and I had endometriosis from the pelvic inflammatory disease and a lot of scar tissue. It was after they took away, because it was in the days when they was before the laparoscopic, when they would go from hip to hip, and they scraped away all the adhesions and took out the scar tissue and the endometriosis, that I was finally able to get pregnant. So it was kind of a blessing in disguise.
Infections in the vagina can lead to an ectopic pregnancy because if they go untreated, they can lead to pelvic inflammatory disease, which can lead to scar tissue.
The symptoms of an ectopic pregnancy are abdominal pain and tenderness. Did you notice any of the previously mentioned symptoms?
Oh, it was horrible, yes. Incredible pain, and it came on. One of the reasons that they thought this, and the first 2 times too, was because it came on so quickly. It was lower. I didn't have an appendix, so they knew it wasn't that. But it was incredible pain, shooting pain, and it came on all at once. So that was one of the reasons that they thought it was what it was.
The first warning signs of an ectopic pregnancy are often pain or vaginal bleeding. You might feel pain in your pelvis, abdomen, or, in extreme cases, even your shoulder or neck.
The tests to diagnose an ectopic pregnancy are blood tests and vaginal or abdominal ultrasounds. Did you have either of these tests performed?
Blood. Ultrasounds, this would have been, back in '84. No, they did not do an ultrasound. Once again, I had no insurance, so they were doing the cheapest possible one. Working for. They did do a blood test. Yes.
An ectopic pregnancy is most common in the fallopian tube.
After knowing the risk factors that you've had in the past, and after having a successful pregnancy, would you consider trying to become pregnant again?
When I had the miscarriage, it was a really difficult experience, and I had one daughter. I didn't think I could have children, so I regret not having a second child. But in some ways, it wasn't so much the risk factor.
Miscarriages and ectopic pregnancies can be emotionally stunting for the woman.
While interviewing Nancy, she mentioned that it was extremely important for women of all ages to know their body. By knowing your own body, a woman may be able to receive an early diagnosis and even prevent further complications with her pregnancy. As Nancy previously stated, there was severe abdominal pain with her pregnancy. Abdominal pain will usually start out very subtle and remain on just one side, with a constant severe increase in pain. During our research, we found the previously mentioned information to be the most important. That information is what we would like women to walk away knowing. Here are a few interesting facts about ectopic pregnancies. Studies done in Nigeria show that women of lower income are more likely to have bad results from an ectopic pregnancy because they are unable to receive an early diagnosis and adequate medical treatment. We want it to be known that neither ethnicity nor nationality are known risk factors for an ectopic pregnancy. A regular pelvic exam is encouraged for women who have a history of complications dealing with the reproductive organs, such as the cervix, uterine lining, fallopian tubes, and the ovaries. Having an ectopic pregnancy can put a woman at risk for future health and fertility complications.